The journal article we chose was Rapid Interventions to Reduce Ebola Transmission in a Remote Village, Garcia County, Liberia, 2014. As late as September 14, 2014, Liberia's Garcia County had zero reported Ebola cases. But on October 25th, a local health department known as the Bong County Health Team had a confirmed Ebola account from a man who had recently left a remote village that had a population of about 800. It was found that the man had contracted the disease from his recently deceased wife and daughter, both of which had consistent symptoms of Ebola. Immediately after this discovery, the health department requested assistance from the CDC, World Health Organization, and many other international partners to prevent the spread of this outbreak. They found a total of 22 cases. Of the 22 cases identified, 18 were lab confirmed by real-time polymerase chain reaction, approximately 82% of the cases. And of the 22 cases, 16 deaths occurred, leaving the case fatality rate at approximately 73%. One major hindrance of the intervention was the lack of road access and lack of direct telecommunications with the village. Thus, interventions needed to be tailored to the local context. The interventions included 1. Education of the community about Ebola and the spread of Ebola. 2. Establishment of mechanisms to alert health authorities of possibly infected people leaving the village. To facilitate safe transport to the nearest treatment centers. 3. Case investigation and contact tracing. 4. Training in hygienic burials of dead bodies. 5. Active case findings and diagnostics. And 6. Isolation and limited no-touch treatment in the village of patients unwilling or unable to seek care at an Ebola treatment unit. The findings could help inform interventions aimed at controlling focal outbreaks in difficult-to-reach communities.
This blog post spends time talking about current clinical trials carrying out vaccines to neutralize the Ebola virus. The vaccine, called VSV-ZEBOV, was developed in Canada. Now it's a race against time. Attention now turns to West Africa, where Guinea, Sierra Leone, and Liberia, where 3 clinical trials are underway to determine if VSV-ZEBOV is able to protect the population against the Ebola virus. In Liberia, testing began February 2nd. Guinea testing started last week, and in Sierra Leone will start this month. It's now a waiting game to determine if these vaccines are able to neutralize Ebola. On the Magical World on Twitter, there is a page dedicated to Ebola awareness, where it helps raise awareness to stop the deadly Ebola virus from spreading. Their goal is to educate the people in Africa and around the world, using #Ebola, #Ebola awareness. Here, people can find several public service announcements, videos dedicated to Ebola outbreaks, and how to educate the people. Like this post where it shows the source, the transmission, and the damage.